Early recognition of acute kidney injury is important because we know there are bad outcomes associated with this problem. There's around about an 18% mortality in UK hospitals for hospitalised patients with AKI and a significant risk of chronic kidney disease. These patients are vulnerable to very significant and sometimes life-threatening complications, and early detection may allow us to reduce the clinical risk to the patient and enhance their recovery.
The problem is that detecting acute kidney injury early can be really difficult. The best blood test in routine use at the NHS today for AKI is creatinine, and even that blood test is a blood test that rises relatively late in acute kidney injury. So what this project has been all about is minimizing the time between when that rise is detected in the blood test and when the doctors and nurses looking after the patient find out about that worrying result. Today, most blood test results are communicated to the doctors and nurses when they look up those results on a computer system. With Streams, we've changed that delivery of information to a push notification so that the second that information is available from the hospital laboratory, it's pushed to a smartphone where the doctors and nurses can immediately see that critical result.
Streams uses the NHS England AKI detection algorithm. It analyses kidney function blood tests in real time. When a potential AKI case is detected, Streams applies specific filters, and from around 2,000 blood tests a day it will generate around 100 raw messages which it filters down to a core of around 25 cases. These are pushed to our clinical team alongside relevant clinical data, and in general the clinical team are able through the application data to triage down to about 6 cases that require bedside clinical review. We've undertaken an evaluation of this care pathway, and to do so we've utilised a mixed methods approach involving quantitative evaluation, qualitative evaluation and also an economic evaluation. The key findings in our evaluation that we noticed a significant improvement in the reliability of recognition, the time to recognition, processes of care improved, and there was a significant reduction in healthcare costs associated with the problem of over £2,000 per case.
The Streams app is most helpful to us because it's mobile and because it works in real time. So we don't have to leave the sick patients that we're with to go and look up their results. We have them with us and we receive new results for those patients as soon as they're available.
As regards clinical outcomes, in the Royal Free Hospital site following implementation, we saw a significant reduction in the time to renal recovery trend. We saw a reduction in the global hospital cardiac arrest rate, and we saw a reduction that was significant in the need for patients following their AKI to be admitted either to the kidney unit or to the critical care unit, often for renal support. We must caveat those findings with our finding that in our comparator site, Barnet Hospital, there were parallel improvements during this period, quite likely related to parallel quality improvement initiatives, and the difference, the change both sites achieved, was not statistically significantly different.
So the implications of the evaluation are twofold. For the NHS, this evaluation shows the great potential for the delivery of digitally enabled care pathways, and it opens the broad possibility for similar pathways to be created for other disease areas. For Streams, it also shows us the potential impact that our technologies can have on the lives of patients and the working patterns of doctors and nurses.